Welcome to AfroNurse Academy, where we turn complex nursing courses into clear, simple lessons. This is the official breakdown of the NMC course curriculum. Whether you're preparing for licensure exams, facing semester tests, or just trying to understand what's ahead, knowing your roadmap is the first step to success. Quick tip before we start. If you're on a smartphone or tablet, flip to landscape mode. You'll see the course outlines, diagrams, and visuals much better that way. What you're about to see is the standard official curriculum approved by the Nursing and Midwifery Council. This is exactly what you need to master. Nothing extra, nothing missing. Now, looking at this outline, you might be thinking, that's a lot. And you're right. But here's where AfroNurse Academy is different. We're going to teach every single topic on this list, line by line, subject by subject. We'll break down each concept into simple, practical lectures that actually make sense. No confusing jargon, no information overload, just clear teaching that sticks. You don't have to figure this out alone. We've got you. So here's what you need to do right now. Hit that subscribe button, then tap the notification bell, because when we drop the next lecture in this series, you want to be the first to know. Grab your notebook, get comfortable, and let's master this course together. Your first real lecture starts now. Let's go.
Right, so Anatomy and Physiology I. Now, I know what you're thinking. This sounds like a lot, and honestly it is. But here's the truth. You cannot be a good nurse without understanding how the human body actually works. This is your foundation for everything else you'll learn. This course is going to walk you through 4 major systems: skeletal, muscular, cardiovascular, and lymphatic. And we're not just memorizing parts here, we're understanding how these systems work together to keep your patients alive and functioning. Let's start with the basics. Before we even get to the systems, we need to speak the same language. So we'll begin with understanding what anatomy and physiology actually mean, how the body is organized from the tiniest cell all the way up to complete systems, and those anatomical terms that sound complicated but are really just describing directions and positions. Once you understand anterior, posterior, superior, inferior, you'll realize medical language isn't as scary as it seems. Then we're going microscopic for a bit. We'll look at cell structure and function because everything in your body starts here. From cells, we'll zoom out to tissue to understand why a patient has pain in a certain area. Knowing your anatomy is crucial. Now, the skeletal system. We're talking bones, and lots of them. You'll learn how bones are formed, the difference between your axial skeleton, that's your skull, spine, and rib cage, and your appendicular skeleton, your limbs. We'll cover the types of bones, their structures, and why your skeleton does more than just hold you up. And joints. We need to talk about joints because understanding how bones connect and move is essential when you're assessing mobility or dealing with fractures. Next up is the muscular system, and this is where movement happens. We'll break down the different types of muscle tissue, how nerves talk to muscles, and that fascinating process of contraction and relaxation. You'll learn the major muscles, where they attach, and what they actually do. Because when your patient can't lift their arm or walk properly, you need to know which muscles might be involved. Then we get to the cardiovascular system. And honestly, this is where it gets really interesting. Your heart is this incredible pump, and we're going to take it apart, figuratively, of course. You'll learn every chamber, every valve, every major vessel. We'll walk through the cardiac cycle, those heart sounds you'll be listening for with your stethoscope, and the electrical activity that makes it all happen. Then there's blood. Its composition, how it's made, why it clots, and blood groups. Because yes, you need to know this for transfusions. We'll discuss cardiac output, blood pressure, what affects it, how to measure it, and why it matters so much. And circulation. We'll trace blood flow through the entire body, the lungs, the heart, the liver, everywhere. Finally, the lymphatic system. This is your body's drainage and immune surveillance system. We'll cover lymph nodes, those vessels, and how lymph actually circulates. It might seem less glamorous than the heart, but it's absolutely vital for fighting infection. This course is dense. There's no getting around that. But we're going to break it down step by step with clear explanations and visuals that make sense. By the end, you won't just know the parts, you'll understand how they work together. And that understanding is what separates a nurse who just follows orders from one who truly understands their patient's condition. Let's get into it.